And you can look to the literature and you can see the pink aesthetic scores and the white aesthetic scores leave an enormous, enormous room for improvement in dental implants, okay? A huge gap. There's a large opportunity for us to get better at this. And I think the problem is good is the enemy of great. So what we have is we have a high implant success rate where the implant doesn't get infected, it stays in the mouth. But the aesthetics and the long-term function of that solution are poor. So what happens is that we've been doing this for a few decades and we have normalized the deviation. And so let me give you an example of what that means. You're driving down the interstate and you're doing the speed that everyone else around you is doing. And that speed is 10 miles per hour over the speed limit. But because everyone is doing 10 miles per hour over the speed limit, you're doing 10 miles above the speed limit. And so what becomes the norm for everyone on the interstate is 10 miles over the speed limit. It becomes the normal speed limit. It's what you think. That's acceptable because that's what we've been doing. So let's take that analogy and bring it back to dental implants. We've been getting dental implants pretty poor in terms of its positioning for decades. We've done it so long that you can go to classes even today that say, look, I'll teach you to be as bad as I am. Okay, now that may hurt, okay? By saying that, that may hurt people, but there are courses out there that go, look, I've been doing it for a long time and I'm this bad and you can be this bad too and it's acceptable. We're normalizing the deviation. We're saying that this level of badness is acceptable and it's not.